Everyone is aware that the U.S. healthcare system is one of the worst performing amongst developed countries, spending the most and yet only ranked 37th best. The government has set out to tackle this by establishing goals of reducing healthcare costs, improving care outcomes, and increasing accessibility to standardized care. The U.S. government and other experts recognize that one of the most critical pieces to solving this healthcare puzzle is the active participation of patients in their own care. But thus far, this has been very challenging to achieve. Enter closeCare, our venture, founded by Noble Ozoka, Craig Buzinski, Teddy Boulay, and myself, Shane Sabine. Over the next several minutes, you'll get to know more about our business, its classification, caveats, and competitive strategy, along with how we align with the 6 factors, our marketing and financing plan, and finally, our valuation. Thank you.
closeCare enables providers and patients to have a more meaningful visit by facilitating communication pre, during, and post-visit. Providers guide patients to post-care either through the patient on the patient's smartphone or through a computer, because there's a web component to it. Patients input their demographics and diagnosis that they want to learn about. Ultimately, the EHR system would identify the patient-specific education for that individual patient. Educational material is presented to the patient in the best way that they're able to learn it and consume it, either through video presentations, audio, short readings, and also text is used to reinforce the learned material. If the patient have questions, they could mark it down, and during their encounter, they could bring it up with their PCP. Ultimately, the goal is to try to have providers and patients speaking the same language, which is the language of better healthcare. We classified our venture as an integrator. Our venture has some characteristics of being a consumer-facing venture in that it's accessible, it's cheap, and it's very user-friendly. However, we decided that we fit more into the integrator role classification because we standardize care and we provide economies of scale in that the same learning material could be used to satisfy the needs of a large patient population. We did not feel like we were a technological venture. Although technology enables a product, there is nothing truly new in what we're trying to, in what we do, and so we did not fit that classification. However, this does not preclude us from becoming a tech venture in the future if we pursue intellectual property, for example. Our strategy is that of a manager and fast follower. There are currently some solutions in the market that cater to the needs of patients and providers. We've learned from these products the successes and most importantly the opportunities that are left on the table, and we've incorporated this into our own venture and given it the capability to satisfy the present day as well as the future needs of patients and provider. We also have a need to better a managerial team, and we're trying to improve it by recruiting a strong manager that has experience as an integrator and has the same vision of integrating patients and engaging them in their own care. Next, we'll discuss the 6-factor analysis and see how our venture aligns with it. Looking at the 6 factors, we'll consider policy and structure together because they're closely related when it comes to our venture. The major public policy driving patient engagement and thus supporting the service our venture provides is the Affordable Care Act, which mandates and incentivizes the adoption, implementation, and use of EHR systems. This policy also mandates that healthcare providers foster patient engagement. Providers currently struggle with engaging patients, and they also worry about the future patient engagement requirements. Furthermore, changes in the payment structure are also forcing providers to act more punctiliously in how they conduct care. We believe public policy and structure is on our side. When it comes to consumers, there's evidence showing consumers are going online trying to find answers to some healthcare problems, and also trying to become engaged in their care. Even as recently as last month, there was research showing that patients were more interested in having access to their care than with the issue of privacy surrounding that access. So we gave the consumer a check as well. When it comes to accountability, although we haven't verified the efficacy of our product, we have evaluation tools and objective measures to see if our product is hitting its target. We'll measure the change in how patients communicate with their providers pre and post pre-care. We'll also conduct surveys, patient surveys, patient satisfaction surveys, to see how patients feel our product influenced that change in their communication with the PCP. Finally, we'll see the change in providers that are meeting certain MU measures, patient engagement measures, pre and post pre-care. Technology, we feel, is on our side as well. There's an increase in the number of people that have smartphones, even the elderly and those in remote areas. And we know this is the people in remote areas are a target that the government is trying to reach with the issues with broadband availability. So we feel with our smartphone app and the increase in smartphones, we'll be able to hit those people. With financing, we feel that if we could prove our app's efficacy, we'll be able to secure financing from ACOs. We also consider that each EHR vendors and insurance, we had some concerns with EHR companies. We had concern that we will not be able to build our brand and would always be associated with the EHR company, and that would give them too much control. They could eventually become a competitor, and since they already have the provider relationship, it would now be hard for us to become established if we were to go separate ways. And with insurance companies, there's always the issue of patient information being shared with insurance companies, and for a young venture, we didn't want to have any such issue. This now completes our 6-factor analysis. Next, we'll talk briefly about the market assessment, financial viability, and valuation analysis. Will be managerial sustainable. Our current team has experience in this space, and we're also considering adding a strong integrator. We also might consider adding a psychologist. Amazon earlier on in the venture, they had a psychologist in the team to try to understand how consumers think while making purchases. We also believe we're a venture that by doing good, we do well. This wraps up our presentation. For a comprehensive look into our business plan, please check us out on Piazza, Team 76. Thank you.